Question 11, which of the following hormone profiles is most likely in this patient? So obviously an endo, well, actually Repro, because we have the Repro hormone. So Repro endo question. Let's go ahead and read through here. A 23-year-old woman comes to the clinic due to irregular menstrual cycles and increased facial hair. So facial hair right away should tell you that it's not 100% of the time, but it's probably PCOS, especially combined with irregular menstrual cycles. Her periods occur every 6 to 8 weeks and often heavy, also very common in PCOS. She also notes weight gain despite no major lifestyle changes, no prior pregnancies, vitals, BMI 31. They're often overweight, if not obese. Acne, another common sign. Finally, transvaginal ultrasound shows enlarged ovaries with multiple small follicles. So, I mean, they gave away the whole bag with pretty much every symptom in the book and the ultrasound findings that we have lots of follicles, or in other words, cysts on the ovaries. Sometimes they'll give away the whole bag like this because they don't want you to have to struggle with what the diagnosis is. They just want you to have to think about the answer choices, and that's exactly what this is. So we have to know our hormone panel here with PCOS. The problem with PCOS, the main problem is that LH is higher than FSH. So when they do that, sometimes it makes it a little more of a memorization question. This one, it definitely is. You just have to know super high yield pathology PCOS. And so that's why I put this question in here, because you really absolutely need to know PCOS. So the problem with PCOS is the LH to FSH ratio is too dang high, just like the rent. So our LH to FSH is typically over 2 to 1. And that means we have PCOS. If you see over 2 to 1, it is almost guaranteed to be PCOS on test day. I have a mnemonic for you. It's called ladies with PCOS have high LH. Ladies with PCOS have high LH. So when you have this high LH to FSH ratio, you have a ton of LH. And what does LH do? You need to know what LH does and what FSH does. FSH is making your estrogen. LH is making your androgen. However, if you have too much LH, yes, you're going to make a lot of androgens, right? So that's where the facial hair comes from. The acne comes from that testosterone, but the androgens then get converted by aromatase in peripheral tissues into estrogens. And the crazy part is this is almost a positive feedback loop. The more adiposity you have, the more fat cells you have, the more aromatase you have. So these ladies with PCOS, they make a lot of androgens. They tend to be insulin insensitive. So obesity tends to be a common problem in PCOS. So not only are they already making too many androgens from LH, they have a lot of extra aromatase making even more estrogen than normal. And so the estrogen here, we would expect our estrogen to be high. So it's either this one or this one. There's just right away. If you knew that much, then you could roll it down to 2. And then the only difference is our testosterone. And of course, we know from the facial hair and the acne that our testosterone is going to be high. So the correct answer is A. And again, this is not so much a logic question as it is a super high yield pathology that you just need to know.